That's the reason why my website is called Whole Body Cures, is because we're looking at all the different causes and we're able to help people with many different things at the same time. So, okay, let's get back to the causes. So somebody who is on their initial stage of care and they come back 24 hours after and 48 hours after, and we find that they come in 3 or 4 times and it looks like it's temporarily better and doesn't seem to want to go anywhere. So then what we do here is we look at also the nutritional aspect of somebody's health status.
Right.
And with that we can see, is there something else that keeps bringing the body back? And once we address that, then the adjustments start lasting longer and the space of time between visits gets longer. So then the frequency goes down and people are, well, you know, I can come in once a month and I'm great with that.
What do you mean, like, what do you mean addressing the cause? I mean, isn't what you do like cracking people's backs? So you just, you know, when you crack the back, isn't that addressing the cause?
Well, okay, there are 2 types of problems in the back, and that's an excellent question. Because I'll tell you, even you could ask many different professionals about this and they're not clear about it. There are 2 types of problems in the back, or the spine I should say. 2 types of problems in the spine. Now, let me just backtrack and say the spine is so connected with the nervous system, and that's why we care about the spine so much. Because it's directly related to the nervous system. The nervous system is actually sitting on the spine and going through the spine. So there are 2 types of problems. One is a problem that is coming from the spine itself, a mechanical problem. The second involves that same mechanism, but is caused by something else. So going back to the spine is either it has had an injury or a strain or something mechanical, some kind of stress, and that causes a temporary or possibly more long-lasting condition in the spine where the spine changes, it compensates. So the problem there is the spine has come out of its normal, optimal functioning, and we want to get the function back into the spine. So we restore the function back into the spine with the chiropractic adjustment, and everything is looking great. And then, well, in some people that'll be it. And in probably 50% of the people that won't be it. And it'll start coming back again. So okay, we adjust it again. We find that it comes back again. So we find that there's some other issue. Now there are 5 common barriers to health. They are the most common barriers that we find in anybody. Could be anybody in the world. The 5 most common barriers.